This is Our Reality, Calabash TV.
Welcome back to the reality show, and now to a sporting event, a celebrity fun sports day designed to draw attention to kidney health. It was organized by the St Lucia Renal Association. Dr. Merle Clarke was instrumental in making the event a reality. Our cameras caught a bit of the action, including the basketball matchup involving well-known media, sports and entertainment celebrities.
Yeah, that's up.
You got a referee? Huh? Gabriel there. I'm Dr. Merle Clarke. I'm the kidney specialist, a consultant nephrologist at Victoria Hospital. So of course today is the 11th of March, the Sunday after World Kidney Day. And World Kidney Day this year was celebrated as always on the second Thursday in March. And it coincided this year with International Women's Day. So the theme in keeping with that was kidneys and women's health, include, value, empower. So throughout the week we've been doing basically talks going around to schools and business places, just again try to sensitize the public on the importance of kidney health. This is our annual event. It's a fundraiser, but it's also an opportunity to meet and greet and to get out, get people sweating, essentially, because again, we want to encourage healthy living, exercise, eating well, because these are the things that essentially are important to kidney health. Today really has been fantastic. It's been energy-filled, it's been fun. The turnout was quite a bit better than we'd expected. Of course, people have been coming and going. In terms of our athletes, they turned out, thankfully. Earlier this morning, we did have members of the opposition. In terms of our parliamentarians, we also had members of the ruling party here. We have members of the Bar Association, the Medical and Dental Association. So just a wide cross-section. Some of our athletes, the Olympians, Joseph, for example, is there. So just a wide cross-section of society, just having fun. Because this is not a serious competitive event by any means. It's symbolic in that we want to encourage people to exercise, living healthy, don't smoke. We also had a health fair on today. We had the opportunity for patrons to get their blood pressures, blood sugars done, also get their urine tested. We had brochures, questions being asked of our dietitian, the physicians were around. So just a well-rounded day. You had an opportunity to have fun, win some wonderful prizes and get some information as well. This is our third edition. We did not do it last year. We did it on a way smaller scale, but we started in 2015. Likely to be an annual event. We would like to make it an annual event because, as I said again, it's also fundraising. It's our main fundraiser, the St Lucia Renal Association, for the year. And of course, funds are important not only to continue our endeavors as it pertains to educating, but also to assist our patients, because treating patients with chronic kidney disease is expensive. Dialysis in and of itself is expensive, and the medications as well are quite costly. Quite a few of our patients are unemployed by virtue of the fact in part that they are on dialysis, so the days missed from work and that kind of thing. So quite a few of them are unemployed. So the Renal Association does serve in that way as a body, a support organization for its members. So we assist with purchase of medication, purchase of surgeries. Our patients perhaps are hospitalized a bit more than the general population. So the monies do go a long way towards assisting with that. What we've been seeing since we started, in earnest in 2015, really intensified our educating. Initially it was slow, but I think we are starting to see a response, not only from physicians in part, but patients and people coming in, perhaps being more concerned about their kidney health. People call, I have blood in my urine, what does that mean? And come in, whereas perhaps before we would miss those things. So we certainly think we're getting somewhere with that. We still do have quite a serious situation as it pertains to patients who come in late and patients who come in already on our waiting list who have end-stage kidney disease. With the move to the OKEU hospital, we currently have 1 extra machine as it stands that allowed us to dialyze 6 extra patients. But we still do have a waiting list. We stand at about 50 something at this point with us taking off, and there's quite a bit of support with patients being supported in the private sector as well with dialysis. But it certainly has not eliminated the list. A promise has been made for a new dialysis unit at the current Victoria Hospital site. Those machines have been purchased, but I guess the works on where exactly that is to be done, that is still pending. So we're hoping that should come in stream hopefully very soon, and that certainly would eliminate the current waiting list that we have, because it would be an 11 machine unit. If we are able to eliminate that list of patients, then our focus, and it is now and it has to continue to be prevention. Because if you don't do that, if we continue to have patients, particularly diabetics and hypertensive, coming in with end-stage kidney disease in a year or even less, we're going to be right back to a situation of a waiting list. And I simply think we cannot sustain it. With the resources that we have as a small country, we simply cannot sustain the cost of dialysis if we continue along our current course. So prevention is important.
Zephyrinus Joseph. I'm here representing the Royal St Lucia Police Force and also as an Olympian. As you know, this is the Renal Week, where we're trying to get people to know that you need to protect your kidneys, take care of yourself so you could have a healthy kidney. I'm really here because I have some family members who are suffering from kidney ailments, and I'm here to make them know, well, I'm supporting them and I'll do anything in my power. So we're just happy that we have a number of celebrities here, what they call local celebrities. I'm happy that they actually call me a local celebrity. So we're all here playing fun sports, lemon spoon, sack race, volleyball, netball, cricket, just to make people aware of kidney ailments. Well, today I took part in cricket and I did the sack race where I actually played dead last. I really thought sack race was an easy event, but I actually got last. I did some lemon spoon, so it's all in the name of fun. Those kind of initiatives where they're trying to get people aware of certain diseases, I feel that the public need to come out and support those events, and it really makes people aware of what it is that affects the body. As I said, kidney plays an important part in your body, and you need to make sure that your kidneys are properly taken care of.
Every year, I meet up with my good friend here, and we do this basketball game for the fun of it all. And of course, this year was a beautiful year for myself and my squad.
Of course, being in the news, you report all the time on the spate of non-communicable diseases on St. Lucia, and we do know, of course, that renal failure is one of the effects of non-communicable diseases like diabetes, hypertension. So we also report on the number of people who are undergoing dialysis right now, and the number of them on the waiting list, and it is a very sad figure. I mean, Dr. Clarke has been doing a great job. We must congratulate her for a number of years in trying to raise the awareness of kidney disease and taking care of your body. And of course, like Scotty said, we do this every year in support of Dr. Clarke and the Renal Association, hoping that these types of activities will get to spread the word, and of course, fulfilling our role as members of the media in educating the public and raising awareness of these types of issues.
I agree. I believe the education is one that is very, very important, and just these activities here we have will help in boosting the education of diabetes. One very important, because I know about diabetes firsthand. Also, we have the folks like Miguel mentioned on the dialysis, and he is correct. It is a very, very sad figure, and I have a strong feeling that with events like that and the St Lucia Renal Association, we will beat that fight. We'll keep fighting a good fight, and we'll end up beating it. I believe the key message for me is take care of your body. All right, take care of your body. Your kidneys are very important, and it's up to you. Okay, it starts with you, and it should end with you. So you should just take care of your body. St. Lucia, especially our folks who enjoy the sweets, the drinks. Okay, lots of water. That's one way.
And of course, we do know that our Minister for Tourism said some time ago on the cusp of the Rum and Food and Rum Festival, we are a rum drinking people. Now, it was taken in the wrong, maybe that's taken the wrong way by some people, but you know, when you really think of it, when you look at non-communicable diseases like diabetes, hypertension, alcohol is one of the leading causes of that. And of course, it eventually leads to kidney and liver failure. So, where instead of castigating when we hear these kind of things, we need to be reflective and look at our habits, our everyday habits, our eating habits, things we eat, things we do, our lack of exercise, preferring to walk, to drive than to just walk a distance, to take a bus, walk to your office, park somewhere. We need to take all these things in consideration, and we need to understand that every little thing we do helps alleviate or reduce our risk of contracting those diseases.
Not a fire officer for nothing.
We're playing and you're taking that beating for the second time.
Next year. Congratulations, Team Sky, Team Ladies, and my team out late. You guys played well. And of course, we're doing this for a worthy cause. So we look forward to being here next year and the year after and a number of years after that. I want to congratulate Dr. Clarke for being in the hard work like she does every year. It was a good game. I enjoyed it. Although I know that the referee must have been paid off because Scotty traveled a few times and he scored baskets. That will account for the minor margin of victory, 2 points only. But congratulations to Team Scotty. I look forward to next year and this time beating him to make it 2-2 next year.
Well, for me, I was not on a recruitment drive. It is funny that he should mention that since I remember somebody doing that a few years ago. Anyway, it was really fun for me. Okay, like I told Miguel, we're not doing this seriously. It's all about fun. And I'm very happy that we had a lot of ladies on our team. Of course, we just celebrated International Women's Day, and the ladies really did put their all into the game. And you could see players like Sarah Lee putting in baskets and who helping us beat a team with a few superstars as well.
We'll hear a lot more from Dr. Merle Clarke on kidney health in other programs on Calabash TV. That concludes the reality show for tonight. I am Bullet Fanis.
This is The Reality Show.